Now let's shift our focus to this very special conversation I had with the dermatologist Dr. Falguni Shah, who's an expert on this, on post-COVID skin and hair care. Take a look. I just want to also, on a very different note, understand post-COVID skincare from you. Do you have any tips for post-COVID skincare? A lot of people who have got COVID, they see hair loss issues. Their skin doesn't feel as it used to feel earlier because their hormones have gone out of whack or their thyroid's gone out of whack all of a sudden. Because COVID is causing all these complications. What are your tips for post-COVID skincare for our viewers?
So one thing is post-COVID hair fall. That is a lot, and that is acute, and we have almost every second person who has COVID comes and says, "Doctor, I'm losing a lot of hair." Now that part we call something called telogen effluvium, and it is very easily you will get back all your hair that you've lost post-COVID. So one is you need to get on the right vitamins, nutritious diet, eventually start walking, and then build up your exercise routine. So get back your fitness, eat healthy, sleep healthy, and also very important is the stress. Because these times are so uncertain, and it kind of makes us so, it just makes people so jittery, and that's where you're going to release the wrong hormones. So kind of stress control, very important. Skincare, yes, post-COVID illness, I've seen that people's skin lose a lot of moisture.
Before skincare, as far as the hair is concerned, say if somebody wants a quick fix, is PRP a good option, platelet-rich plasma, for the hair?
Yes, PRP is a good fix, but then before going into PRP, sometimes just using some topical medications and the right vitamins also helps.
Yeah.
But PRP does help if the hair loss is combined with hair thinning. Like it's not just hair fall, but you have a history of hair thinning where along with losing the hair, you're not even getting back the hair. In such cases, PRP does help. Yes.
Right. And coming to skincare now, what is post-COVID skincare routine that people can follow?
What I tell everyone is start using a sunscreen first thing if you've not been using, because you will try that will maintain your collagen.
And lots of it, Falguni, isn't it? Because somebody told me that use 2 spoons of sunscreen, and I've been putting 2 spoons every day.
Yeah, one is the quantity, because you need to apply the right quantity, and second is the how often you put it, because the effect of a good sunscreen lasts only for 4 hours. So after 4 hours, essentially your skin is without a sunblock. So if you applied a sunscreen in the morning at 7, then by 11:30, your skin is actually without a sunblock. So apply a sunscreen after every 4 hours, very important. Hydrate your skin, so use a right kind of moisturizer. Don't use a harsh face wash or anything which is very fragrant or anything which has a lot of acids in it, like glycolic acid or the beta hydroxy acid, salicylic acid. Don't use that for some time. Use a gentle soap-free cleanser. So even if you follow these 3 steps, like sunblock for the collagen, for maintaining your collagen, hydration to give the suppleness to your skin, and a gentle cleansing lotion. Start with these 3 things.
So
and
these
your
3
vitamins,
are the most
I think,
important, right?
Cleansing, moisturizing, sun protection. I think that is what your regular skincare should look like. But after, I mean, if you have normal skin.
Yeah, and after COVID, if somebody wants to just regain their youthfulness and the way their skin felt earlier, of course, these 3 steps will be followed, which are basic. Say if they want to spend a little more money, would you recommend a laser or microdermabrasion or certain photofacials, or what is it that you would recommend?
Yeah. I would definitely ask them that if they are okay to go ahead with it, they should do something which is a Q-switch laser. We call it laser toning. Photofacial is another word for it, because and that also something which is a fractionated Q-switch, because it helps in building the collagen and also it helps in evening out the skin tone. That is one thing. Sometimes we can even do basic peels. You know, like a lactic acid peels to the chemical peels, because lactic acid increases the hydration. You could do a glycolic acid peel to give an even skin color. If someone is a little bit older, then doing some things like radio frequency, which is a monopolar radio frequency, helps in building the collagen. So you'll get that elasticity that you've lost back, or skin